So here's the deal. You are the RN, you have graduated, you've passed the NCLEX exam, and we'll discuss that in a little bit, but you need a job. Some of you in this pandemic world will be given a permit, if you will, to practice as an RN, so you'll be a graduate RN without even taking the NCLEX exam. But that does not negate keeping to study for the NCLEX, so we'll discuss that later on after the presentation, if you will. But the focus is that you will have passed the NCLEX, and you will need that job. So you need a job. Any job? I always tell new graduates, don't give in to that refrain. You are a nurse, you are a professional, you're a member of the most trusted profession. You are the reason patients recover. You are the reason that families communicate with us. You are the reason patients learn new healthy behaviors that improve their health outcomes and their health literacy, therefore improving their quality of life. You are that reason. You're the reason that hospitals achieve magnet status, and you are key members of the healthcare team. You are the leaders. Do not forget that. And you have been, whether you know it or not, you've been that professional member of the most trusted profession since you started nursing 3. When you did your final capstone, you really were the nurse. And every day you should have been looking in the mirror saying, I am the nurse. You need to build your confidence. You have this. You may not have seen it in every aspect of nursing school. You may not have done every procedure. You may not have seen every disease state. But you certainly have the foundations. You're certainly intelligent enough to know what you do know and what you don't know and where to look for help. You are a professional. So where do you start? I always start when I tell people I can do anything with the nursing process. So start with the nursing process. So in the nursing process, we add PI, correct? We assess, we diagnose, we plan, we implement, and we evaluate. So what's the assessment? Assess yourself and your potential employees. So when I say assess yourself, I'm asking, what do you have that's different from the graduate in your class who sat next to you the whole time? Maybe you're bilingual. Maybe you're a member of Sigma Theta Tau. Maybe you were president of the Student Nurse Association. What are the things that set you apart from everybody else who's interviewing for the same position? Diagnose. Will the environment that you're looking for promote your growth? You want to make sure that you're looking at a potential employer for potential job growth. Will it spark your interest? Will they support your educational endeavors should you decide to go back for your BSN, for your MSN, for your DMP, or your PhD? Will they give you that support? Will they help you develop your leadership skills so you can move into a leadership role, whether it be the nurse manager or the CEO? And what's your plan? Do your research. Who is your potential employer? What are the benefits? What are the perks? What do you see as positives? What do you see as negatives from this job? What do you have that's unique and sets you apart? So put that into your plan. Implement. Right? You have to update your resume. Okay, that should be implementation 101. Update your resume. Submit your application. Meet with recruiters. In this pandemic world, you may not be able to meet with them face to face, but call them. Send them an email. See if you can set up a virtual appointment. Meet them. Dress for success. And follow up. Follow up with every resume you send, with every email you send. I say, I sent you an email. I realize that you're getting many emails and many resumes from many new graduates because it's May, but I really would like to meet with you at your earliest convenience or set up a phone call with you at your earliest convenience. And then make evaluation a lifelong process. Right? Evaluation of where are you? What should you add to your resume? What do you delete? What should you highlight? What should you bold for your resume? What do you need to do to get that next position? Um, do you need to become certified in critical care? Do you want to become a certified nurse educator? Do you want to be ER certified, cardiac certified? So what is some geriatric certification? So what are some of your goals? So always evaluate where you're going, what's your next step, what can you do to make that step a successful step. Assessment. Assessment is the same as anticipating. Consider the hospital. Consider the setting that you're going to work in. Are you working in a hospital? Are you working in a clinic? Are you working in a school? Are there certain things that you would need to be successful in those areas? Are you working in a teaching hospital? Um, right? A teaching hospital typically offers a lot more experience. It has also, not only does it have nurses, but it has residents, it has physical therapists who are learning. So it really has an interdisciplinary team that you can tap and you can use to strengthen your skills. Um, does the position you're going after, does it require a BSN? If you're in New York, you have to get your BSN. If you come from an associate or a diploma program, you must get your BSN within 10 years. That's the idea of the BSN in 10. New Jersey, a lot of the hospitals are asking that you do it in 5. So does it require a BSN? Does the position you're looking at require certification in any of the specialty care areas? What is the salary? What are the benefits? What are the opportunities for professional growth and career advancement? When you look at benefits, you're not just looking at dental, medical, and vision, but what are some of the educational benefits? What about vacation benefits? What about personal time? You want to make sure that that highlights and that sweetens the package when you're looking for a job. And you want to know that ahead of time. Because that may weigh where you look. My first jobs, I really looked at in how, what was the travel time? That was my biggest consideration. I went to school in New York, and hospitals, you traveled by train. So the consideration for me was, what was the travel time? On the worst case scenario, how long would it take me to get there on the train? So consider that. What shift do you want to work? Do you want to work nights? Do you want to work days? Are they only hiring for nights? Are you terrified to be alone at nights? If they're going to give you a night position, what kind of supports do they have in place to make you successful, or to help you be successful? Because you will be successful. You just need the right mentors. Assessment of yourself. That's really the most challenging part for new graduates, your self-assessment. So what are the qualities, like I said before, what are the qualities that set you apart from all others? If you look at a little dozen eggs, they all look alike. But one little egg looks different. How can I tell you apart from every other new graduate in nursing school? Right? We all look alike. We all have our RN, we all passed our NCLEX, we all have the same curriculum. So what sets me apart? Maybe I did IHI modules. Maybe I already took a critical care certification course. Maybe I took EKG interpretation. Maybe I took sign language. Maybe I speak a second language. So what sets you apart from the other little eggs? Because you're special. You're exactly that. You're special. How are you going to be an asset to the institution? So you want to highlight your critical thinking. I said before, IHI modules. Maybe you did IHI modules. Maybe you are bilingual. What are your communication skills? Are you self-directing? Are you able to stay calm and handle a challenge? What's your education, your life experience? Maybe you have a degree in another area. Maybe you've worked as a certified nursing assistant, a PCA. What is it that you have that makes you an asset to this institution? You must highlight that. Diagnosis, alteration in student status. Oh my goodness, you've graduated, you need a job. Congratulations again. So review your your potential employers' mission and vision statements. When you go for job interviews, people are going to ask how you're going to fit with their mission. So know your future employer's mission statement. Know what their vision is. Know what their goals are. Review the organizational chart. Where does nursing fit in the organizational chart? You've all had some sort of a leadership class where you've looked at organizational charts. Is it flat? Is it pyramid? So where does nursing fit? How does the institution, how is it viewed by your community? Does it offer community classes? Does it offer healthy living classes for the community? Maybe potential classes for diabetics, potential classes for cardiacs, exercise classes, classes for new moms and babies. How does the community view your institution? Right? So when the hospitals go for magnet status, they have to give so much to education for their faculties and their staffs, and they also have to give so much to the community that they serve. So what type of community involvement does your hospital have? And that will also give you more options for professional growth. Does the institution or organization, how is it viewed by their employees? What's the turnover rate? Do the employees, maybe you know somebody there, how do they feel they're treated by management? Do they feel their voices are heard? Are the nurses and on the medical staff, are they permitted to sit on committees that really promote patient health and safety? So on safety classes, on do they have a say in how the hospital gets staffed, in what kind of education? Do they care about the educational needs that you're looking for? Do they value your opinion? And so ask people who work there, people that you're working with. You were on units as nursing students. What was the scuttlebutt on the unit? Speak to each other. So if you know that I worked at Jersey Shore, did my clinical at Jersey Shore Medical, and you did it at Riverview, maybe someone did it at Bayshore, maybe somebody did it at Monmouth Medical. What are some of the things that they told you about? Because nurses are always observing. We're always looking. We're always listening. And we understand. We can input this and file those things. So your fellow nursing students have some of the information you're looking for. But don't be afraid to ask the nurses who work there, what's it like here? If you had to do it again, would you take this position? Excuse me. And then your plan. So based on your diagnosis, weigh the benefits of your potential employee. So, if any of you have met me before, I'm big on dollar store notebooks. And I know that you guys are big on electronic notes in your computer. So put it in. I'm looking at Monmouth Medical, okay? I'm looking at Jersey Shore Medical, I put in resumes. I'm looking at Robert Wood Johnson, I'm looking at St. Peter's. So, list for you, what are the benefits? They have good health insurance, they have a great educational support team, they have, they admire and they accept your input for solving patient problems. So create a pro and con list for each of your employers, your potential employers. What's the salary? What's the benefit? Tuition support, paid vacation, sick time, personal time. Look at the turnover rate of their employees. How much voice does the staff have in day-to-day operations? What's the potential for professional growth and advancement in the institution? Is it magnet status? Is it a teaching hospital? Is it a community hospital? Are you a school nurse? Will you need your certification? Where can you go? Will you be a school nurse in one school, or do they cover a multitude of schools? So take a good look at that. What's required? Distance to work may be a factor. I told you before. That was one of my big factors. What would it take to get in the train? How many, would it be an hour? Would it be a 20-minute train ride? Set your priorities at this stage in the process. What's really good for you? What are you looking for? If you're just looking to explore different venues, and maybe you love med-surg, and try and get a position in med-surg. It's interesting. So you have to have a plan. when I first got out of nursing school, everybody wanted to go to ICU or the ER. And they said, oh, you have to have med-surg experience. That's not necessarily true anymore. When I started to run an ICU, I was hiring new graduates, but you have to have a good support. We ended up creating a 6-month orientation program. And the new grads had somebody. They had a mentor, they had a preceptor, and they had formal classes to help them learn what it was to be an ICU nurse and the challenges that may arise. So you want to look at those processes. You may not want med-surg. And the other thing is, people tell you not to do long-term care. I think long-term care, med-surg nurses, they probably work the hardest out of all of us. Because if you're in the ICU, it's a surgical ICU, you're getting surgical patients. If you're in a cardiac ICU, you're getting cardiac patients, so you know what you're getting. You're in a med-surg floor or you're in a long-term care facility, you don't know what's going to arise on a day-to-day basis. So there are many more challenges to those areas. So see where you want to be, see what you think. Think about what you liked in school, what you didn't like about your rotations, what attracted you to it, why do you think you would fit best there. And those are the selling points that you're going to use to sell yourself when you interview with someone. Implementation, clear, confident communication. Okay, I always tell people nursing is all about the C words. Communication, clear, concise, and community. Who's our community? I'm talking you as my community right now, but it may be the population in general. But nursing is all about those C words. Clear, confident, concise communication. So, first thing right out of the bat is you've got to update your resume. What are some of the things you did special in school? What did you graduate with a 4.0? Highlight your achievements on your resume. Complete and submit your applications for your selected organizations or institutions. And you can go on and look and see, what do they require? Do they require letters of reference? And maybe before you even finish graduating, before you get to May, maybe you need to start thinking, who's that clinical instructor who really was a mentor for you, who really sparked your growth, and can you ask them for a letter of reference? Ask your former employees for a letter of reference. And follow up with those nurse recruiters. They are getting many applications now, and many things have been pushed to the side with COVID. So you really have to follow up with everything. And write thank you notes. All right, you're going to think I'm old-fashioned, and I am. But write a thank you note. As soon as you finish your interview, just send an email. And make sure you know the person's name with the interview. So I want to thank you for your time. It was wonderful to meet with you. I really do believe I will be an asset to your institution as your mission and values truly align with how I view healthcare and patient care in today's world. And you got to push why you would be an asset to that team and institution. Then evaluate. Just as education is a lifelong process, so is evaluating your professional career plan. I never thought that I would end up in community health. I was med-surg. I wanted ICU desperately. Did med-surg. While I was doing med-surg, I took the ICU course. I took the EKG interpretation. I took ACL. I got my BCL. I got my instructors. I really pushed so that I got my CCRN. Really, really pushed. And then community health came up. And I was like, all right, I'll try it. I have to tell you, if you had asked me 40 years ago when I got out of nursing school, would I be in community health? I would say no. I have to say, I truly love it. I would say I wouldn't have been in education, but I love that too. So always evaluate your professional career plan. It changes. It grows, it expands, it adapts as you grow and expand as a professional. But you are the professional, and the one thing I can guarantee you is you will continue to grow. So you want to make sure that the organization or the institution will provide you with education, skills, and knowledge that will assist you in reaching your professional goals. That is the one thing that is certain. So you will get a job, and not just any job, but the job you want, because you are the nurse. You are a nurse, you're a professional, you're a member of the most trusted profession. You are the reason patients recover. You're the reason patients learn new health behaviors that improve their healthcare outcomes. You improve their healthcare literacy, and therefore that improves their quality of life. So remember the nursing process. Professional growth truly requires assessment and evaluation. You are the key to your own success. You can do it with persistence, getting along, confidence, organization, and really resilience and excellence. Those are all the qualifications that you already have. You just have not given it a polish or a shine. So now's your time to polish and shine. So that's the end of my presentation. I will be in this room, and I will be waiting, hopefully.
Alrighty, so Dr. Poitier is here if you guys have any questions for her. I think everybody should be able to see her, and you can put your questions into the chat or use the Q&A session. And let's just wait for some questions to come in.
Yeah, and can they all hear me at this point? Yes.
Okay.
Sure.
Here we go. Brandon wants to know, what's the best way to approach an employer about a job they usually do not give to new grads, such as the ICU, the PICU, etc.?
And I think that the best way is, if you go back to the presentation, is to absolutely highlight what your skill set is that sets you apart. And like I said in my presentation, that's a very old-fashioned attitude that some people really do believe that, but not much anymore. You have experience. I think you need to highlight it, tell them what experience that you've done with school, what experience that maybe you've done as a part-time nurse. I don't know if you're a certified nurse's aide. Maybe you've taken an ECG interpretation class. So what are some of the things that you'll bring? Anxiety. I see Alexandra asked about anxiety before an interview. I'm going to tell you that doesn't go away. I had a job interview yesterday, and I must have paced around before the interview. It was just a 15-minute phone call. They were weeding out people and for further interviews, and I thought that I'd have a heart attack. So those don't go away. I think what you have to do is to remember that you're prepared, you've done your homework, and doing your homework ahead of time really will help decrease the anxiety. I had done my homework. I had questions I wanted to ask them. I had an idea of questions they may ask me that I was prepared to, and I knew what I wanted to highlight on my resume. So doing your homework ahead of time, and like it or not, taking good deep breaths and just relaxing, probably a little less coffee, which would be my challenge. Okay, I'm just going to go back to your what's the best way to answer interview questions? Answer interview questions honestly and openly. Regina, did you want to answer that question live, or Doshel? I think somebody wants to answer that question.
Sorry, that was me. I'm just trying to check off the ones that you were answering.
Oh, okay. I wasn't sure if somebody else wanted to answer because there's only so what are some of the questions? I think that's what it was. Some of the interview questions, and I did. In fact, I'll send to Regina Adams a list of a guideline for you to write your resume. But some of the questions, most common interview questions that they're going to ask you are, what are your strengths, what are your weaknesses? So always make a list. Go back to the dollar store notebook, use your notes in your phone, make a list. What are your strengths? I am organized. I am a self-starter. I am a good team player. I view the whole picture. I do not get stuck on the little details. I can identify what I don't know that I need to have additional information for. So what are your weaknesses? My weaknesses are maybe I speak too softly and I need to speak a little bit louder. Maybe one of your weaknesses is that you don't take credit for, and that's a weakness. You don't take credit for what you do. Nurses have a hard time doing that in general. They don't treat their own employees. And you can say that as a weakness. And where do you see yourself in 5 years or in 10 years? Why are you interested in working for this hospital? Why are you interested in working for this screening center? So what you want to do is tell them, and that's where you rely, you do your homework. You look at their mission, you look at their value statements. What are they? I've spoken to some of your employees and they really value promoting nursing education and a commitment to lifelong learning. So I'd like to be a part of that team. So tell them, let them know by answering these questions why you're interested in working here. Where do you see yourself? Let them know you've done your homework and that you do it. Why are you leaving your current employer? Well, you're not leaving your current employer. You're graduating. That was one of the questions they asked me yesterday. Why am I leaving? And that's really tough. So you're leaving for career opportunities, professional opportunities. So if you have a gap in your employment, you have a minor gap. Maybe you have a career in something else. Why do you have a gap? You have a gap because you went to nursing school. What can you offer that someone else can't offer? If you go back to the presentation, I said, we all look alike. We all graduated nursing school. We all have our RN. We passed. We're ready for jobs. What sets Mary up from Susie, from Regina, from Brendan? What sets me apart? What special skill set? Maybe, like I said, I'm bilingual. Right, someone just wrote, Trish just wrote, I'm the clinical educator for the ED at Cooper. If you get your ACLS and PLS before your interview, that will impress her. So that's another thing, doing your homework. If the positions you're looking for require special certification and you get that ahead of time, that's a plus. And it may be challenging for some of you right now because you're really focused on studying for the NCLEX. So you want to focus on that. One of the other things are you willing to relocate? Are you willing to travel? That you may be asked those. What about some questions? I'm trying to think. So we have, I'm planning to be an OR nurse. Should I start at a lower position first or go as a staff nurse? I'm an LPN planning to take RN boards. Well, congratulations, Wally. I don't know that, and this is how things keep going on. I don't think any of the positions in nursing are lower or not lower. I think if you want to work in rehab, if you want to work in cardiac, if you want to work in recovery room, they are all valuable nursing positions. They usually do not. A lot of people will give you an opportunity, and you have LPN experience. That may highlight, if you can highlight what skill sets you have as an LPN, that may strengthen you or taking a position directly in the OR. Someone else asked, what are some of the things that you want to ask your interview? And that's always challenging because, and they will give you a chance. One of the things you might want to ask them is, what does a day in the hospital, a day on the unit or the setting that you, what does it look like for a typical RN? How do you spend your day? So you could ask them, what does that look like? What are the company values? So you can say, I know the values. What are the characteristics that you're looking in new employees? What do you look for in a new employee? Maybe I can highlight that I do have those characteristics that you're looking for. And that always tells them again, hey, what are your favorite part about working for this company? Ask an employer, what's your favorite part about, working for this company? Um, what makes you happy? What makes you happy? What does success look like? If I'm going to work here at Hospital X, what does success look like for a new employee? And what are the opportunities for professional growth and development? Because all hospitals have opportunities for professional growth. Best way to ask about desired pay. Marisol, you'd have to do your homework. You can see from HR what they're doing, what their salary is for a new grad, for somebody with experience. You can ask them. I understand that the salary for a new grad is $65,000 per year. Is there any way that may become increased if I come with additional certifications? If I come with a degree in another area? Hiring and recruitment, it used to be that hiring and recruitment was, and this is for Natasha Goff, regarding the recruitment process. Is there a certain time during the year when hiring and recruitment is high, and hospitals are searching for new grads? I think that with COVID, this has been a challenge now, because people are starting to, after the first wave, people came back. Nurses who had retired came back to their units to work to fill the void and to fill that extra need for nurses. And I think they're now with this, now that it's calming down a bit, they're going back to their retirement, so there should be a new wave. Nursing is always cyclic in its ups and downs. Where we would have seen a real down point 10 years ago, nurses didn't retire when those baby boomers turned 65. They didn't retire because the economy was bad. So the economy may influence again now if people will retire. Typically, we used to see a lot of positions in May with everybody hiring because of new grads. But don't forget, we graduate. We have rolling graduations and rolling admissions in many of our schools of nursing. So we have graduates in December. We have graduates in May. We have graduates in August. And hospitals are well aware of that. And when they post positions, you really have to go on to the hospital, go on to the community, the VNA site, and see what positions they have. If you're looking for school nursing typically positions become available like the teachers at the end of June. So you need to look for those there. I don't recommend, if you feel you need additional med surge as a new grad. I happen to like med surge. I really wanted ICU, but I did happen to like med surge a lot. But it's not necessary. You have the knowledge, you have the strengths, and you know what you need to learn. You know what you need to focus on, and you know enough that if you don't know something, to look it up and to identify a good mentor in your unit. So I don't think so. I'm going to say personally, I don't think you need to start off on a med surg unit. If you're already working on a unit, this is someone's question. If you recommend, if you're already working on a unit, you want to be a nurse. In the meantime, while in school, do you work as a tech or a nurse's aide? That really depends upon your own situation. I happened to work because I needed the money when I was in nursing school. I also needed the experience because nobody else in my family was a nurse. Nobody actually went to college except for my one brother. So I think that depends upon your situation. And the other thing is, nursing schools so challenging for learning that you may not be able to handle a work environment in addition to that. So that really is a personal type of thing. To me, it was a great opportunity. I worked as a nurse's aide, and we actually called them nurse's aides, because I got to cement my skills. I met a very good friend who stayed my friend and was my mentor as I graduated. And when I was done with all my assignments for the unit, she was brutal. She was worse than having that clinical instructor that scared the dust out of you, because she was like, okay, what are you looking at school? Bring your books, you have to do this, you have to do that. So, and what do you recommend if you're already working in a unit you want to be a nurse on? Here's a challenge. Some units do not hire their own. So that's, I guess, between you and your nurse manager. I think it's an asset to have somebody who actually is already knows your unit and already has a relationship with the staff, because that's one of our biggest challenges, and that's one of your key points that you're going to do. What are you're a team player, so you're going to highlight that. What's the best way to highlight them? So if you already know the unit, you know the people who work there, so your team, you establish team playing capabilities. Apply for a job. I think you should look for jobs there, just to go on the websites to see what are the institutions, who might be hiring, what are some of their benefits, and then you might want to ask nurses who are there. I mean, it's hard to sit. You can't sit down in the lobbies anymore and drink coffee and then say to the nurses, "What do you like about working here?" But ask your fellow students who have had clinical rotations there, what do they like about it? What was one of the big pluses? What was one of the negatives? Because there's pluses and minuses to an institution. The biggest thing right now is to get ready for NCLEX. And I alluded to before that you may get a permit. You still have to pass the NCLEX exam. So I would, focus my on NCLEX exam at this point. Somebody asked about nursing residency programs. Some institutions have nursing residency programs, and that's great, but there's not enough positions in graduate. And that's one of our challenges. And I think that as educators, we need to look at that. We need to develop partnerships with hospitals so that our students can actually graduate and be considered a paid resident and work there. I think they're great, but they're very competitive. Some of them may have them for you if you're in, let's say this semester you're in nursing 3, and during the summer there's no nursing 4, you're going to go back in September. Some of the residencies will actually offer summer employment as a resident or certified nursing assistant because you're, and pay you during that, and then guarantee you a job if you guarantee them 2 or 3 years. So that's another thing you should start looking around on different websites, have an idea of where you think you might want to work, and keep your mind open to smaller hospitals. They may have enough perks for you. They may have opportunities that you didn't think existed. So don't ignore the smaller hospitals and start looking to see what do they offer. Somebody else wrote, I see that they posted, Lena, 1 year nursing experience. Do clinicals during school count towards this year's experience? We have a nurse recruiter, I think, in the audience. But I think if you can highlight your clinical experiences and give an example of that you were a critical thinker, maybe you identified an issue with an IV pump and how you noticed it, So it's hard. A lot, and again, that goes back to, do we hire new grads, or do they have to have experience? Many people don't have experience. You're a new graduate. How are you going to get experience? So that's an employer that's a little unrealistic. You might see that as maybe a specific unit, but generally hospitals should not be asking for 1 year experience. Again, I go back to my own. I only went to take a job as a nursing aide because nobody in my family was a nurse. And I was like, I already put 2 years into school, and I'm thinking, what if I don't like this? What if this is not for me? You know, so that experience worked out well, and was good. But I think that you highlight your good clinical experiences. Many of you have excellent clinical experiences, and you're doing that last semester of a preceptor program in your hospitals. So really highlight that. One question, Destiny. What's the best way to approach employee about a job they usually do not give to new graduates, but specifically for an LPN going for RN? Are you an LPN, Destiny? Is that where this is coming from? I'm unclear with that question, Destiny. Okay, so new graduates, but specifically for an LPN going into an RN. So do you have that? What's the best way to approach? Usually do not give new grads. So you can say that, highlight your experience there that as an LPN, and say, I'm going to be finished, I'm going to graduate, I'm going to have my RN, I'm going to get my RN license, and really push that. Again, you've got to highlight what is special about you and what assets are you bringing to this institution.